To the hardworking health officers, barangay officials, respective delegates and representatives, a blessed day to all of you. I am Maya Tresbayas Tayag, one of the representatives of Municipal Health Office, and I'm here to give you information about the current situation we are facing right now, the COVID-19 pandemic. As we all know, the COVID-19 pandemic has caused significant disruptions and hardships in every aspect of our lives. It indeed turned our world upside down and welcomed us to a new kind of community, a new correlation to the earth, and a new human experience. By the end of the speech, you will be more aware of what people should do during this time of pandemic, such as knowing the precautions we may apply to prevent this disease from spreading. But first, to get a better understanding, it is essential to learn what COVID-19 is, how it started, the symptoms and effects, and how dangerous it is. Coronavirus disease 2019, or also known as COVID-19, is an infectious disease caused by a newly discovered coronavirus. It was started in Wuhan, China last December 8, 2019. This virus is thought to have emerged in the Wuhan live animal market from an interaction between human and animal. According to scientists, it is highly likely that the possible sources are raw bats or raw snakes. As a general rule, the consumption of raw meat or uncooked animal products should be avoided. Raw meat or raw animal organs should be handled carefully to avoid the cross-contamination with uncooked foods. This infectious disease has rapidly spread throughout the world, which led it to a global health crisis affecting all the spheres of society. According to statistics, there are 453,000 total cases, 419,000 recovered, and 8,833 deaths. Coronavirus infects people of all ages. However, evidence to date suggests that two groups of people are at high risk. These are older people and those with underlying medical conditions. Since they have a weaker immune system, it is difficult for their body to defend them from the virus. Furthermore, the virus that causes COVID-19 is mainly transmitted through droplets generated when an infected person coughs, sneezes, or exhales. These viruses are too heavy to hang in the air and quickly fall on floors or surfaces. Everyone can be infected by breathing in the virus if they are within close proximity of someone who has COVID-19, or by touching a contaminated surface and then their eyes, nose, or mouth. Like other respiratory illnesses, it can cause mild symptoms including a runny nose, sore throat, cough, fever, fatigue, and shortness of breath. The infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death in more severe cases. Nevertheless, there are simple precautions we can take to reduce the risk of infection and transmission. First, wash your hands frequently with soap and water for at least 20 seconds. Second, avoid touching your face with unwashed hands and keep them away from your eyes, nose, and mouth. Otherwise, the germs in your hands can take up residence in your mucous membranes and cause infections such as COVID-19. If you are to go outside, bring your alcohol or sanitizer with you. They are said to kill the virus that may be in our hands or any part of our skin. Always wear your face mask. It can reduce the spread of infectious droplets when someone speaks, sneezes, or coughs. Lastly, and most significantly, maintain social distancing. The virus spreads easily through physical contact from a person to person, and keeping a safe space for at least 6 feet can get you rid of the virus. Physical distancing aims to slow the spread of virus by stopping chains of COVID-19 transmission and preventing new ones from appearing. May we obey all the health rules and protocols in order to be part of fighting this coronavirus and ending this pandemic together. That would be all. Thank you for the opportunity to speak with you today. Stay informed, be prepared, follow public health advices, and always remember that prevention is better than cure. God bless us all.